So, good morning, ma'am. I am Sunshine Veranza. So, our group gonna discuss about the Philippine medical discoveries through the ages. So, first we have the pre-colonial era. So, the pre-colonial era started before 1565. So, the focus of this era was about traditional healing, herbal medicine, and spiritual practices. So we also have here the two major medical discoveries or innovation that our public health milestone in the Philippines. So we have first the ancient practices such as traditional herbal medicine. Example of this is Herbularius and Albularius knowledge. So for the short description for this, the ancient practices or of Herbularius and Albularius provided accessible and affordable and holistic primary health care using indigenous medicinal plants and healing roots, thereby sustaining the health and well-being of the communities long before the advent of formal medicine in the Philippines. So during this pre-colonial era, the Filipino society relied on such as traditional herbal medicine derived from local plants and administered by practitioners like herbularios who specialize in herbs, and the highly respected albularios, the general folk healer who combine the herbal remedies with spiritual techniques, prayers, and rituals like pagtatawas to treat both physical and supernatural cause of illnesses. So for the second example is that we also have traditional healing such as the babaylan, katalonan, or spiritual healers, also known as spiritual healers, and manghihilot, traditional masyos. They provided holistic care by addressing spiritual, skeletal, and muscular needs in the absence of the Western medicine. So we have here the short description of how this discovery or innovation improve health of or the quality of life of the Filipino. So the traditional healing practices of the Babaylan and Catalonan improve health and quality of life by providing holistic and culturally resonant care that address physical ailment alongside spiritual and psychological distress, offering comfort and stability to communities in the absence of formal medical system. So, for the pre-colonial era, we have here a key Filipino scientist or doctor who support this study. We have Dr. Nelia Cortez Maramba. He, she's also known as the mother of the Philippine herbal medicine. So for the second one, we have the Spanish colonial era. So it is started on 1565 to 1898. So the Spanish colonial era, the introduction of the Western and formal medical education and the establishment of structured hospital system. So we have here the two major medical discoveries or the public health milestone in the Philippines. So first we have in 1565 onward, it is the establishment of hospital. Example of the hospital is Hospital Real de Españoles, San Lazaro Hospital. Formalize and centralize the patient care for military, lepers, and general sick population. So the short description for this discovery and how this improved health medicine, the quality of life of every Filipino is that the establishment of this hospital is starting on 1565. Formalize patient care by creating centralized permanent institution for treatment, research, and also isolation, especially for infectious disease like leprosy, which began the shift from the scattered traditional healing to a structured, organized public health system in the Philippines. So, for the second one is late 19th century Dr. Jose Rizal Medical Practice Ophthalmology. So Rizal trained in Europe, specialized in ophthalmology, performing complex eye surgeries and advocating for public health and sanitation practices. So si Jose Rizal daw ana. So a short description for this how Jose Rizal discovery improved the health medicine here in the Philippines is that Jose Rizal medical practice and advocacy elevated quality of life by introducing advanced European ophthalmology to treat blindness and eye diseases. So, while simultaneously promoting modern public health and sanitation to prevent widespread illness, thereby laying the groundwork for the scientific preventative medicine in the Philippines. So, the one key Filipino scientist or doctor who supported the study of the Spanish colonial era was Leon Maria Guerrero. He is also known as the father of the Philippine pharmacy.
So for the continuation, I am Rachel Joy Bagood. I'm going to report or discuss the early 20th century in 90s. So the first one, in 1920s, tiki-tiki extract early research by Dr. Manuel Zamora and Dr. Patricinio Valenzuela, and the third one is Dr. Alfredo C. Santos. Eliminated infantile beriberi or taon, or devastating disease caused by thiamine or vitamin B1 deficiency. By producing an effective, concentrated extract from rice bran, which became an early life-saving supplement. So for the short description of this, the discovery and production of tiki-tiki extract from rice bran effectively eliminated infantile beriberi, a devastating vitamin B1 deficiency, by providing a locally developed concentrated and life-saving nutritional supplement, drastically reducing high infant mortality rates and improving child health the early 20th century here in the Philippines. So, in the early 20th century, kanang diri na ang time sa kuan kanang naay medicine and technology started to improve quickly. Here in the Philippines, many Filipino scientists made important discoveries that help kanang makasave of lives and improve sa ato ang health. People focus on discovering cures for diseases, improving public health, creating new medicines, and using science to solve every problems. So, why is it important? Nganong importante man jud ang kuan kanang cure sa beriberi? Kay it help cure beriberi, a sickness caused by vitamin B1 deficiency. Many babies and children were saved because of this discovery. Kanang ang tiki-tiki jud daw ang kanang una ay nakuha nila ba na discover nga maka-helps to cure the beriberi. In simple words, tiki-tiki is a local Filipino medicine made from the rice bran that stop a deadly disease in children. So the second one is in 1990s to the present, conotoxin research by Dr. Lourdes G. Cruz. This fundamental biochemical research on peptides found in poisonous cone snail venom led to the discovery of potent pain relievers like ziconotide or Prialt that are 1,000 times stronger than morphine and non-addictive, providing a new class of treatment for chronic and severe pain. So for the short description of this, Dr. Lourdes G. Cruz, pioneering conotoxin research, significantly improved health and quality of life globally by identifying peptides from cone snail venom that led to non-addictive pain medication, or also known as ziconotide, far more potent than morphine, offering a revolutionary treatment for patients suffering from severe and chronic pain.
So for the continuation of the report, I am Rizal A. Maglente. So we're gonna discuss now the 20th century pioneers in 90s to 1980s. So we have there si Dr. Fidel Mondo, which is um, She was a renowned Filipino pediatrician born in November 27, 1911 in Manila, Philippines. So she dedicated her life to improving child health care in the Philippines and made significant contribution to the field of pediatrics.
Wala pa. Go.
So one of the invention of Dr. Fidel Mondo is the bamboo or drone incubators in 1941. So it saves infant lives in rural areas. So si Dr. Fidel Mondo may nag-invent sa bamboo drone incubator. So it nag-help ni to improve the survival and quality of life of premature infants because it provided the low cost and non-electric, and it locally made way to regulate their body temperature. So this simple device offered essential warmth and thermal support to babies in rural and underserved areas where modern medical technology was not available. So now we proceed to the next 20th century pioneers, which is si Dr. Enrique Austria. So si Dr. Enrique Austria was born in June 23, 1941. And he's renowned Filipino pediatrician and neonatologist who made significant contribution to the field, including the developing a low-cost neonatal ventilator and pioneering meconium drug testing. So, one of the invention of Dr. Enrique Austria is the drug detection in newborns in 1972. So, it developed a method to detect maternal drug use through meconium or first stool of the baby. So, it allowing for early diagnosis and management of drug dependency in infants worldwide. Dr. Enrique Austria developed a meconium-based drug detection method that significantly improved the newborn health because it allowed early and accurate identification of maternal drug use. So this early diagnosis helped to ensure that drug-exposed infants receive timely treatment and proper management, which greatly improve their chances of healthy development and has since been used in worldwide.
To be continued, I am Mia Jane Waimero, and now I am going to discuss in the contemporary era in 1990s until in the present. So in 2000s, the RX Box telehealth device, it is developed by the DOST and UP Manila, bridge the health gap in the remote areas by providing a portable, multifunction biomedical device that allows rural health workers to collect vital signs and transmit them for specialized teleconsultation. In the short description, the RX box or the prescription box telehealth device is significantly improve health access and quality of life by providing and the rural health workers with a portable, multifunction biomedical tools to accurately collect vital signs and instantly transmit data for remote specialist teleconsultation, effectively bridging the health gap in isolated Philippine communication. So the RX box or the prescription box telehealth device, it is a handy device that helps health workers to get the vital signs of their patients. So it's like the device will automatically send the information to the hospital and the doctor. So it's something like that the patient receive advice from the doctor through that device. So mura siya virtual consultation. So let's move on to in 2010, the hydrogel for wound healing, it developed by Lorna S. Anyas. It is a carboxymethyl hyaluronic hydrogels or the CMHA
for enhanced wound healing and tissue regeneration by creating a biocompatible materials that retains moisture and deliver drugs. So it's in short description, it is a gentle jelly-like wound dressing that helps wound heal quicker by keeping them moist and delivering medicines right where it is needed. So it helps to heal the wound faster, tissue repairs better, and patients are more comfortable. So we also have Dr. Lourdes J. Cruz. She is well known as a Filipino scientist who studies chemical from marine animals or marine biochemistry. Her research has helped in medicines and understanding marine organisms. So that's all. Thank you.